Hello everyone. Thank you for taking the time to watch a short educational video on nasogastric tubes. My name is Eric Bradley. I'm a first-year surgery resident here at Cape Fear to provide tips and shed light on common mistakes that we have recently seen with placing and maintaining NG tubes in adults. So let's go over some common indications and contraindications on why you would place a nasogastric tube. Indications include to maybe drain gastric contents and decompress the stomach, in such cases like a bowel obstruction, maybe obtain a specimen of gastric contents, or maybe assess for gastric bleeding. You want to maybe drain or lavage after drug overdose or poisoning, prevent vomiting or aspiration in a trauma setting, or use for enteral feeding initially. Some contraindications would be cases of severe head trauma where there's concern for a basal skull fracture. In this case, you should use an orogastric tube. Recent nasal, throat, or esophageal surgery, esophageal varices or strictures, or history of gastric bypass. So the materials that you should gather include what I have here on this table. So let's start with the easy stuff. So let's go ahead and get a piston syringe ready, 60 mLs. Some extra suction tubing so you can hook it up to your wall suction or suction device. Of course, your sump NG tube. It usually comes with this connector within that NG tube, and then we also have a Christmas tree adapter if you need it. Some lube, adhesive dressing to go ahead and put the tube connected to the nose, and a cup for water and a straw. There are many different types and sizes of NG tubes that are available based on the hospital that you are working in. The main choices we have at Cape Fear Valley include Salem pump tubes and various sizes of feeding tubes. When choosing a tube for your patient, consider the main purpose of the tube. For bowel obstructions, consider a sump, such as the Salem sump tube. The large lumen allows for easy suction of gastric contents and medication delivery, while the smaller vent lumen allows for atmospheric air to enter and equalize pressure in the stomach once the contents have been emptied. This prevents adherence to the stomach and prevents damage to the stomach lining. On the other hand, if the main purpose of the tube is for feeding, consider a small, more flexible tube without the sump, such as the kangaroo feeding tube. Okay, next we'll talk about patient positioning. So you want your patient upright, and there's a few questions I'd like to ask them before I get started, such as, do you have a preferred nostril? Have you had a prior history of injury to your face, specifically your nose? And if you don't have a preferred nostril for your patient, you can actually do something very quickly. You can do a sniff test by closing one nostril and having them sniff, like such. Next, I'll show you how to measure for proper length. What I like to do is take the tip of your tube, find where his xiphoid is, hold it about a finger's breadth below. I'll come up toward his head, around his ear, leave the tube out, like so, and measure to the tip of the nose. That's a pretty good estimate to make sure that you get into the stomach. Now we're going to talk about inserting the NG tube. So after explaining the risks and benefits of the procedure to the patient, I'll definitely take my tube and I will lubricate it. Of course, this is a mannequin, so I'll use the mineral oil provided. You should probably use water-based lubricant. Have your patient sit up and have his chin tilted down. And at this point, I usually ask for someone to help me hold the cup. So as the patient's head is tilted, I'm actually going to take the tube and go straight back into his nasal cavity, okay? So I'm going to insert and stop. And at this point is when you should instruct your patient to go ahead and start sipping on the water. And ideally what should happen is he starts to draw the tube down into his stomach. And you keep inserting until you get to your estimated mark on the tube. If you meet extreme resistance, you should stop. If the patient begins to choke or cough significantly, remove the tube, allow him to get over that, and try again. According to Cape Fear Valley's policy on NG tube usage, they can't actually be used or hooked up to suction unless you have confirmation of placement. The preferred method of confirmation of placement is an X-ray showing that it terminates in the stomach. You can also auscultate over the stomach while flushing air into the sump. Or if you have contents coming out of the NG tube, that's another confirmation that it's actually in the correct place, especially if it's bilious. So sometimes a physician will ask you to go ahead and start decompressing the stomach, in which you may do so. After confirmation of tube placement, let's hook up the tube. So here's your tube without the connectors. So let's go ahead and put our Christmas tree clear to clear. And our suction tube is also white and clear. We'll go there. Our sump is blue, and we should put the blue side together. And that is the correct way to hook up a sump nasogastric tube. So let's talk about some tube maintenance. First of all, I want to make sure that the patient's bed is at least 30 degrees elevated. And every 4 hours, make sure that we actually flush the tube to make sure that it's patent. You can use your piston syringe up to about 30 of water in the actual clear tubing and pull back, and then free air into the air tubing, and make sure that it actually moves without resistance. Also make sure that you are recording ins and outs daily. So to go over some common mistakes that we have seen with these, this of course is a sump one-way valve. The blue area actually is where the air will move in. So whenever you hook this up, just remember blue goes to blue and air will freely pass in through the air tube, and that's what you want. Sometimes when you walk in, it will be around this way. Just remember, white to blue is not the way to go. Also, occasionally when you walk into a room, you can see a knot tied here. Unfortunately, this isn't the best way to go about this because now you only have suction on a single spot within the stomach. You have a high chance of causing injury to the stomach. If this is the case, go ahead and undo this knot. Make sure that you flush the NG tube itself a couple of times just so that you can clear it out. There's a high chance now that this tube might actually be clogged, so make sure that this stays patent by pumping air as well. Another thing that I would do as I walk into a room is make sure that all of the connections are properly connected, fitted, and that you have suction situated as recommended by your order. And if you see any problems, go ahead and fix it right then and there. Well, thank you for watching the video, and I hope that this was instructional and informative and will help you understand a little bit better on how to place NG tubes.